I've noticed that a lot more patients are asking about their lip area, but they're a little bit terrified because they don't want to have, as it's termed, the trout pout. So how do you tackle that?
Well, I mean, first of all, the main population of my patients are not in their 20s, so it's not what they look for first. So they're more actually harder to treat because the lip gets longer, it wraps in, it gets thinner, and it's drier, and you start getting the smoker's lines, and so I need to treat all of that. Plus, you can't now not lift as much when you smile, and all of that, so I need to address all of that. I don't obviously do the pout lips because it's not what I do. I could, but I don't. So I create that whole area by looking at the lines, and I have treatments for that, and it's something I invented about 10 years ago that I've worked with that works extremely well for that. And I love sculpting a lip, and I have a diagram of about 15 different injecting points to create your lip for you, and it's not going to be a pout lip, because actually the challenge is for it to be able to move and smile and show your teeth. In my past life, when I did oral surgery, I was actually doing I was sculpting the gums and the bone around the teeth to have the sculpting line and for the lips to fit exactly in a perfect level. So
you've had experience of both sides effectively.
Yeah.
And it's interesting because I only thought that you would get smoker's lines if you were a smoker, but that's not the case, is it? It's just something that happens as we age. So actually it's nice to know that those things can be dealt with in a relatively simple way.
Yeah, and without you going out looking like you've been filled up completely.
Yeah.
And there's a process for that as well.